Hi, I'm Dr. Salil Kandwala, the medical director at Advanced Urogynecology of Michigan. Today we'll discuss what is mixed urinary incontinence. Just give you an understanding of this particular condition. It's nothing but a combination of stress incontinence and urge incontinence. Stress incontinence is the urine leakage that happens with strenuous activities such as coughing, sneezing, lifting, anything that is strenuous that results in leakage in the absence of a bladder contraction is called stress urinary incontinence. So understanding the anatomy, you have the bladder right here, the urethra is below that. So this is the front, this is the back, this is the head end, this is the foot end. So you're looking at a woman from the side. This is the bladder, which stores the urine. This is the urethra that brings the urine to the outside. The vagina is behind that, the uterus on the top, and the rectum is at the back. So that's how the typical pelvic organs are structured and in anatomic proper placement. The muscles below that keep the organs in proper place. The bladder is filled up with urine, and it comes from these two little openings called the ureters. And then as it fills up, it empties out, and that results in classic urination. So this is the normal storage and emptying of the bladder. Stress incontinence is with any strenuous activity. See, what happens is the dotted line is where that urethra was at rest. And this is where it should remain when she is straining. But what happens is if the muscles are weak, this junction falls back. And because it falls back, it funnels open that urethra, resulting in urine leakage. Very similar to us, I'm standing up nice and strong. If I fall behind after some degree, I'm going to fall back. So urethra per se could be strong by itself, but when it drops back, it funnels open and resulting in stress incontinence. And that is classically called hypermobile stress incontinence. So this is the urethra, and let's say we were to put a Q-tip in there, you can see when the bladder and the urethral junction falls back, the Q-tip angle to the horizontal goes more than 30 degrees, and that is considered hypermobility of that particular urethra. Sometimes that sphincter muscle around the urethra could also be weak. So instead of the urethra being nicely closed, it may be opened if this muscle is weak. And that is called intrinsic muscle deficiency or intrinsic sphincter deficiency of that urethra that could result in stress incontinence. So these are the two mechanisms why you can get stress incontinence, when the urethra is falling down or if its muscle is weak. The other condition is called urinary urgency incontinence or overactive bladder, and is characterized by urgency with or without urgency leakage, usually with increased daytime frequency and nighttime frequency called nocturia, and there is no proven bladder infection or other obvious pathology. So in absence of that, if you have this, that's called overactivity of the bladder. So what's typically happening? So in a child, as the bladder gets filled up, it sends a signal to the spinal cord that says, hey, I've got to go, I've got to go. And the signal comes right back and says, all right, buddy, go. So this signal here tells the bladder to contract. This signal here tells that urethra to relax. So bladder contracts, urethra relaxes, and now you have urine or voiding. So that's how a child voids in a diaper. But then as the child gets older and smarter, the frontal cortex, the intelligent lobe, gets involved, and it says, no, I have to go to this particular room called the bathroom, and that is where I need to urinate. I can't just be doing it in this diaper. So that frontal lobe inhibits. So when the stimulus is coming up, the pons, the part of the hindbrain, that stimulates it. But the main intelligent lobe in the cerebral cortex, that inhibits, that means blocks it. So it's like you have a car which is parked on a slope and your brake is pressed. So it is pressing the brake nonstop. So the sensation is constantly happening. It's happening in me as I'm talking. It's happening in you as you're listening, that the bladder is saying, hey, I gotta go, hey, I gotta go. But the brain is saying, nope, the brake is on. So its pedal is nicely pressed down. The car is on a down slope, but nothing is happening. Now, you know what's going to happen if you lift the pedal off the brake? Car starts moving. Something happens, and that results in urine leakage because this either the sensations get stronger or the brain's inhibition or the blocking effect gets weaker. So let's say your foot starts coming off that gas pedal, the car is going to start moving forward. That's exactly what happens. The bladder starts contracting. Once it starts contracting, then you have urine leakage coming out. This is the gotta go problem. It's not with coughing. It is where you feel that, oh my God, I've got to go to the bathroom. And before you move, urine is just pouring out. Is it? That's urgency incontinence. Is this common? Well, it's very common. At least 1 in 3 women are affected by urine leakage, irrespective of age. Well, you may not get in a 17-year-old possibly, but once you get into the 30s and 40s, you'll see this stress incontinence and urgency incontinence. So what's the next step? So you have been provided with certain forms, and you've seen the video on why do we do these history forms and what is the importance. There are some specific forms in the history form that talk about urgency versus stress incontinence, how much does it affect your sexual function, and how much it affects your quality of daily life. Once that is done, when you come to the office, we will do something called a vaginal examination. And that examination is done either in the lying down position, but with stress incontinence, I may have you stand up and cough in the standing position. And finally, we do this urodynamic testing, which is a graphic representation of the bladder. As the bladder is being filled up, we're looking at this graph. Now I typically do it with the patient standing up. And also, we look inside the bladder with a tiny telescope. So you're watching with me. Takes me about a few seconds to look, make sure everything is okay. There's nothing wrong with the bladder, especially if there's some concerning symptoms present. It's important to make sure that the bladder is normal. Bottom line, the testing that you'll undergo in the office is very straightforward. It is very important for you to fill out those history forms correctly and make sure that you get those forms to us in way ahead so that you have a pre-visit appointment done. It's all taken care of. But this condition of mixed urinary incontinence is very, very common. But the treatment has changed so much, and the chance of success and satisfactory improvement is so high. And most of these things can be done in the office or an outpatient facility. So that is the beauty of how we manage things. To the point that today, most common regret of our patients is, I wish someone had told me about this earlier. Why did not anybody tell me? Well, I've told you now, and if you follow this lead and you see the different videos I have on my website, they'll talk to you about the management. If you want to see them, you're more than welcome to see them before you even come in to see me. So the question is, why wait? Get your life back, do what you enjoy doing. There is no reason to suffer in silence. Say no to pads. That is the key. Pads hurt and they're not good. So there are so many things that we can do to help you with this condition. Please make sure you send those history forms in properly. Do the preview visit. So when you do the preview visit, we have everything there. You already watched this video. So when you come in, I'll then figure out with the testing, which is more dominant. Is it stress incontinence or urgency incontinence? Once we decide which one is more important for you, and also what did we find, then we can institute the appropriate therapy for you. Next step, as I mentioned, I will see you at the office for the evaluation, and feel free to check out any other videos.